Hi, this is Susanna, certified nurse midwife and owner of the Villagers Women's page. What do I do as a midwife? I take care of women and help babies out. Today I want to briefly talk about the second trimester of pregnancy. The second trimester of pregnancy is between week 13 to week 28 of pregnancy. So that is the 4th month to the 7th month of pregnancy. We consider this period a time of honeymoon, so the honeymoon phase of pregnancy, because it's usually this time if you were feeling sick or if you've had nausea and vomiting in the first trimester, usually at this time by week 13, week 14, it should have resolved by now. And that is because the beta HCG or the pregnancy hormones level are depleting at this point because placenta has taken over their function, and the placenta is sustaining the pregnancy. So yeah, you do start to feel more energetic, you start to feel better, you feel like you can conquer the world, you can do anything. But at this time also, women tend to feel a lot of back discomfort, hip discomfort, just everything stretching out. This is when you also experience what we call the growing pains. So that is when the uterus is enlarging. The growing uterus causes the ligaments that are holding up the uterus to stretch out, and that could cause what we call the round ligament pain, meaning the ligaments are stretching and just accommodating the growth of the baby. Yes, that can be very uncomfortable. Back pain, hips pain, just everything hurts, joints hurt, total pain. What you can do at home to help is lots of stretching exercises. Before getting out of bed in the morning, you want to stretch your hips, move your hips around, stretch out your muscles, stretch your entire body before waking up and going about your normal activities. At night, prior to bedtime, if you're still feeling achy, you can consider a warm bath. Occasionally, you don't want to do that too frequently because then that could cause infections too, especially if you're sensitive down there. So occasional warm baths help to also relax your muscles. You can also consider yoga exercises, stretching. You can consider going to prenatal classes that are geared towards mostly stretching the pelvis and the hips. So another thing you could try is also visiting a chiropractor, because at times as the uterus grows, your coccyx or your tailbone goes off alignment, and that could be painful as well. So you may want to consider a visit to the chiropractor to see if they need to do some kind of alignment. Try to get one that works well with pregnant women, because not everyone is familiar with the pregnant body. So find someone who specializes or who is familiar, who's got experience working with pregnant women. Another thing you could try is a pregnancy belt. So pregnancy belt helps to lift your uterus off your pelvic bone and the ligaments, and that will give you a break from the discomfort, especially when you're pretty active in your pregnancy. For me, during my pregnancies, I was an emergency room nurse, and then I became a midwife. So, very busy. Those two areas are pretty busy areas. So I never went anywhere without my pregnancy belt. I never went to work without it. Whenever I left it at home, I cried because I know by the end of the day, I won't be able to walk to my car to go home at all. This is actually one of my old pregnancy belts. This is probably about maybe 9 years old. So I believe this is about 9 years old, and it's still, I'm keeping it as a souvenir because I just love it. I found it so helpful during my pregnancies that I don't know, I just don't have the heart to throw it away, even though I don't need it and I will never need it again. But I just wanted to keep it as a souvenir. So this is a Medela brand. I love Medela. I love Medela, especially their pregnancy belt, because they are very comfortable. They're very easy to wear. You just snap it on. They have Velcro on the side here. So you just wrap it under your waist. I wish you could see. Maybe I should pretend this is my waist or my hips. Let's pretend this is my waist here. So you just want to go right underneath your belly, under your hips, and snap. That's pretty much it. And the belt lifts. It gives you a nice lift to the uterus, which in turn provides some kind of relief. It gives you a nice lift of your uterus away from your hips and your pelvis, and that in turn helps to relieve that discomfort in the hip and the pelvic area. I swear by this. If you start to have discomfort in the second trimester, hip discomfort and back discomfort, consider a pregnancy belt. So there are some cases where you will need something to help you with pain if everything else fails, or maybe occasionally you're achy and you've tried stretching, you have your belt and it's just not helping. There's some things that we can do when you come to see us, when you go in to see a provider. Tylenol, Tylenol is very safe in pregnancy. Check with your provider, make sure it's the right medicine for you before considering it. But yes, Tylenol is safe for pain. Nice warm compress also helps. One more thing I want to discuss before I leave is about traveling. I get this question a lot, so I just want to touch on it before I leave. The second trimester is actually a good time to plan for travels. It's a very blissful time in the pregnancy, so meaning you're not feeling sick, you're energetic, you feel great, except for maybe occasional back pain and hip pain. Some people don't even experience back pain at this time. Some are just lucky like that. But yeah, the second trimester is a good time to make travel plans. But of course, you want to check with your provider. Make sure it's safe for you personally to travel, depending on what's going on with the pregnancy. And also depends on your medical history. If you have an absolutely low risk pregnancy with no complications at all, the second trimester is the best time for you to consider traveling. If you like what I do, please consider subscribing to my channel for more videos to come. And I'll see you next time. Bye.